Welcome,
Yeah,
everybody. Let me introduce you to the moderator of the session, Dr. Satyanarayanan ji. He is MBBS in he did his MBBS in Stanley Medical College and an MD pharmacology in Madras Medical College, Chennai. He is currently working as Associate Dean, Student Affairs, and Professor of Pharmacology in SRM Medical College Hospital and Research Center of SRM IST. Welcome, Satyanarayan ji. Dr. Satyanarayan,
yeah,
over to you.
yeah. Thank you very much, Aparajita Singh ji. So, good evening and welcome everyone. I heartfully welcome you all for the panel discussion today, which is on need for holistic human health. First, let me introduce our esteemed panelists. The first panelist is Sri Deepesh ji from Kottayam, Kerala. He is the regional coordinator, Southwestern region of NCCIP, AICTE. He has done his BTech and MTech from Kerala University, and he had experience both in IT industry as well as academia and connected with universal human values from 2022. His significant work is a volunteer in online and offline UHG faculty development programs in the role of resource person, coordinate students workshops, etc. So our next panelist is Dr. Swapan Chanana from Ludhiana. He has been teaching in the Department of Business Management of PCTE group of institutes and for the last 25 years. Additionally, he is also handling the responsibility of Director, Students Welfare. And a significant work is he has been teaching the subject of universal human values regularly to various courses like MBA, PTech, BCA, etc. And our third panelist is Dr. Mirnalini. She is from Chennai and she is working as Associate Professor of Anesthesiology in SRM Medical College, Hospital and Research Center, SRM IST, Tamil Nadu. She completed her MBBS from Tanjore Medical College and MD from Anesthesiology from Stanley Medical College. She is a certified pain management physician from National Health Education, England. Her significant contribution is he has got 10 years of teaching and clinical experience. She has authored 2 book chapters and has 11 publications. And she is part of the USC team in SR Medical College, where she has guided many students in UHG courses. And right. So let us move on to the next panelist, Dr. Soumya E.S. from Bangalore. She is working as assistant professor RNSIT, teaching in the department of EEE. Significant work is she is a UHV coordinator for a RNSIT UHV cell, exploring UHV since 2023. Part of the UHV volunteers team for various projects. The fifth panelist is Dr. Aparajita Singh from Mumbai. She is working as assistant professor TAMS SDR, served as HOD and deputy director in the same institute, teaching in the department of MCA. A significant contribution is exploring UHG since 2020. Join hand. Yeah. So I express my heart a warm welcome to all of our respected panelists. Before we dive into the discussions, let me explain the process briefly. To begin with, let's hear a recap of some points that we may have already heard in the keynote session. Then I'll put forth questions to the panel for discussion, requesting your views. Each panelist will have 3 minutes to briefly put their response. A stopwatch will appear on the right upper corner of your device of screen. Please keep an eye on that as you speak, and I request each of us to adhere to the time limit. And first, let me invite Dr. Sharmila Asthana to provide UHG point of view from on holistic human health. So, Dr. Sharmila Asthana did her MBBS from Mahatma Gandhi Memorial Medical College, Indore, MD Pediatrics from Regional Children's Hospital of Southern New Jersey, USA. She worked as assistant professor of pediatrics in Philadelphia, and she in India. She came back to India. She is a senior, she was a senior consultant pediatrician with Apollo
2-3 lines enough.
Yes, sure. Significant work is she has dedicated herself for the universal human values and pursuing holistic approach to health. And welcome, Dr. Sharmila Asthana. Kindly give your UC point of view on holistic human health. Over to Dr. Sharmila Asthana.
So namaste. Welcome to all the esteemed panelists. If you can go to the, So let's dive right into what we heard in the keynote. I'll just give a brief recap of that before we get into the panel discussion. So if we look at WHO statistics regarding our current state of health, we find that the leading cause of death worldwide, 74% of all global deaths, are because of non-communicable diseases today. These are diseases between, deaths between the ages of 30 and 69 years, very premature. 4 big killers that we may be aware of: cardiovascular diseases, cancers, respiratory diseases, diabetes. So every year we have thousands and thousands of millions of people who are dying from this. In India alone, about 5.8 million people are dying every year from this before they reach the age of 70. Next slide. So if you look at some of the risk factors for these non-communicable diseases: unhealthy diets, physical inactivity, alcohol and tobacco, air pollution. These are the 4 big ones. The good news is all of these are preventable. So 80% of premature heart disease, stroke, diabetes, they can be prevented. Next slide. So if we look back, we have had many achievements in health. We've had a lot of success with communicable diseases. Of course, COVID is an exception, but if you look at vaccinations, we have eradicated diseases like polio. Antibiotics have revolutionized medical care. Trauma care has become extremely advanced with state-of-the-art techniques. We are saving many, many more lives. But having said all that, we also have very many concerns regarding the health of the people. Like we just mentioned, the alarming rise in non-communicable diseases, mental health issues, depression is increasing, anxiety is increasing, stress is at an all-time high. And of course, the impact of this mental health on the physical health. So diabetes, high blood pressure, obesity, all this is on the rise. Besides these concerns regarding the health of the people, there are also a lot of concerns regarding our healthcare systems. So where is the focus of our healthcare system? On being healthy or on getting rid of disease? Even for disease, are we curing the disease or are we managing the disease lifelong, giving medication? Are we addressing mental health adequately? These are some of the concerns we may have regarding our health systems. Then there are some other fundamental issues. Are we really service-oriented, compassionate to the needs of the sick? Or has the system deteriorated to a fee-for-service transactions with the focus largely on profit maximization? So do we really have values and ethics in the healthcare system today? That is another concern. It's become overly expensive, out of reach for many. So whether the system as such is sustainable in its current form. So ultimately, we need to ask this question: do we need to look for a change? Is our perspective right? Is there a need to change something? Talking of perspectives, if we look at fever as an example, is our perspective one that fever is beneficial or one that is harmful? Is it an illness or merely a symptom of some problem in the body? Because that's going to decide what we do with it. Do we need to jump to reduce the fever? Is reducing a fever sufficient? So if we look at the reality of fever, it is actually beneficial for the body. We all know it is an indicator or a symptom. And in fact, it's beneficial because it allows the body to overcome the infection more efficiently. So just like covering a wound with a Band-Aid is not really the solution, curing the wound is. Suppressing the indicator is not the important part. Correcting the disharmony in the body is. Next slide. So if we look at our perspective on health, we have increased longevity. We have all this, facilities, sophisticated instruments, state-of-the-art technology, diagnostics, better detection of disease. But do we have better health? Are we healthier than before? Or are we suppressing the very indicators of the disharmony in the body, like we do with, medication for decreasing blood pressure in hypertension, medication for decreasing blood sugar in type 2 diabetes, reducing pain in arthritis, and so many more like that. Next slide. Ultimately, if we look at the WHO definition of health, which was put way back in 1948, and it still stands good, it talks of health being a state of complete physical, mental, and social well-being. So does our traditional Ayurveda talk of all of these, including spiritual well-being. So are we there yet? Are we addressing health adequately is the question. Next slide. In fact, the WHO seems to be rethinking about this statement on health to explore this fourth dimension of health, the spiritual well-being of health. So is there a need today for a more holistic perspective on health? So now I will hand over to Satyanarayananji to Dr. Satyanarayanan.
Yeah, thank you, Dr. Sarmila Asthana. You raised very important concerns. I feel seems to be genuine, like alarming rise in non-communicable diseases, mental health issues, and at all-time high stress. So let us ask our panelists what they feel about these things and what is their opinion on this in light of what was just discussed. So does the current functioning of the healthcare system seem efficient and adequate? Or do some of the concerns raised seem genuine to you? Do you think there's a need for change? Let me ask the first panelist, Sri Deepesh A. Welcome, sir. Please, you can give your inputs.
Right. So I was listening to the keynote lecture as well as what Dr. Sharmila Asthana was speaking right now. So I'm coming from that modern medicine background. And what I'm thinking about is that currently, if you look at the situation, modern medicine is doing pretty well right now. And with the advent of technology and the state-of-art technology and the diagnostic services right now we have, it is at its best, and the progress which is happening in the case of modern medicine is amazing and very prospective as I see it. So if you look at the non-communicable diseases which we were talking about, I see that the modern medicine is doing pretty well, and especially in the case of antibiotics or the surgery, all those areas, I see that modern medicine is doing pretty well. So, and the latest development which we see as part of the development in the artificial intelligence and the robotic surgery is going to revolutionize the current technology. That's what I understand. And like in a fast-paced modern world, people don't want to waste their time. So, and the modern medicine gives an opportunity for people to just swallow a pill and they are back to work. So in that context also, it is like the quickest way to solve these health issues. That's what I understand. But then again, as you say, the holistic approach is probably something which we can think about. And I'm looking forward to understand and maybe more curious about what is happening. Since I'm not from that background and have not done much investigations on the area which what you are trying to say. So I'm curious about what is being discussed here, even the content, what is being put in the keynote lecture and what Dr. Sharmila has put forth here. So that part I will look into that. And if I say something about the background from what I'm trying to, from where I'm coming, I'm in the neuro biology, where we have been working a lot of research on the neurobiology part of it, and the neurosurgery part is also like working fantastically to solve the most of the problems where we were able to diagnose, and the research is also going in the right direction. So I don't see a better way as of now. But if you are trying to put forth something better, I would be definitely open to understand that. So that's what I think from at this point. Right. That's all from my side. Over to you, Satyavran.
Yeah. Yeah, thank you, Sri Deepesh. I think you feel it is doing well already enough. You all think all ills can need only a pill. So you feel that. I think you are open to all the suggestions, whatever being made. Okay, let us move on to the next
Yes.
panelist. So what the next panelist thinks about these things, does the current functioning of the healthcare system seem efficient and adequate, or do some of the concerns raised seem genuine to you? Let me invite Dr. Swapan Chandanaji for his valuable inputs. Welcome, Dr. Swapana Chandanam.
Namaste. Very nicely, I've listened to keynote speaker Ganesh ji and even Dr. Sharmila, and then my fellow panelist, Dipesh sir. So I belong to Ludhiana. It's an industrial town. So here also, like Dipesh sir is saying, that's a sign of development. A lot of hospitals with very nice infrastructure and with nice machinery and all latest. Everything is available, and sometimes it is seen as the sign of the development. But then, when holistically we see that most of the hospitals are full, means there is no space. And most of, because I have this experience, I've been to the hospital last year. My mother-in-law and father-in-law were admitted. And then I happened to see there that most of the people who are coming, even the young people, are like Dr. Sharmila was telling, the stress is increasing, mental health, and even the cardiovascular, this heart diseases. So even youngsters are like in India, it's raising very fast. So they are coming there and it's all full, and they're all psychomatic diseases, and they're coming again and again, means they're not improving, just they are working on the symptoms. Once they get improved and they get again into the same lifestyle, even the doctors are trying to tell. When I observe this, the doctors say that, okay, change your lifestyle before they write to the medicine. But here, sometimes the people are so busy in earning money the whole day, they're not ready to do the physical work or exercise. As the patient also said that it's easy to take a pill and go to the work. So even I've seen the people who are requesting the doctor that we don't have time, we are businessmen, and we are busy in our work till late night, and we can't we can't get up early in the morning and work on our body, yoga and all. It's easy to take medicine. So I think the need of the hour is like how can we decrease this means all this pressure on the hospitals and all. So holistic approach, as Ganesh sir was also telling, the solution centric, we are working on the symptoms. So I think the need of holistic education, and I think the need of that taking the responsibility of my body. So my means I, means self. So I think this is the need of the hour, that this human values education, that holistic view is needed, so that we can work on the problem for means solution, not only the problem again and again. So this is my take on this. Thank you.
Yeah, thank you, Dr. Swapan. So you feel that there's a need for change that has been brought because of your experiential experience with the hospital and the patients, and they are in time management is difficult for them to manage things. Okay, so let us move on to the next panelist, Dr. Mirnalini. So what do you think? Does the current function of the healthcare system seem efficient and adequate, or do some of the concerns raised seem genuine to you? Do you think there's a need for change? Let me welcome Dr. Mirnalini. Please, ma'am.
So, like everyone, I have also been listening to this keynote sessions, And for me, I think there is definitely a need for change. Like what I am seeing in my practice, there is a significant rise in non-communicable diseases. Though this current healthcare system has been able to curb the communicable diseases transmitted by some bacteria and viruses through antibiotics and everything, for the instances of non-communicable diseases, there are also many statistics and studies which have proven that there is a alarming rise in non-communicable diseases. And in my practice, I am seeing that this non-communicable disease is beginning to start at a very young age also. Like in previous generations, what happened in 55 and 60, it's now happening in 25 and 30 years of age. And in addition to this, I'm also seeing increased rates in anxiety and depression and stress-related disorders also. And about our current health system, as I'm practicing, I see that it is focusing more on managing these symptoms rather than addressing this root cause or um, thing, and more focused on the body. So there is complete ignorance of this mental health aspect and the interconnectedness of mental health with the physical health. And like some of the panelists have highlighted, there is definitely an increase in technology and diagnostic procedures and imaging procedures and robotics and AI, but this has also led to an increase in cost also. So this increase in cost, as we all can acknowledge, it is not being affordable to common people. And this healthcare system on a whole, I can say it has become commercialized. So at individual level, I can say that the individual healthcare professionals at their heart are having a feeling of relationship and empathy towards the patient, but they are also being targeted by many commercialized institutions for targets on the quantity rather than the quality of services. So this in turn puts out a picture like there's a lack of empathy among healthcare professionals or to the public. And all these concerns, I feel it has raised questions about sustainability, whether addressing only the symptoms of the body and treating human being only as physical body and going to specialist for the different ailments, and this increase in cost and this perceived so-called lack of empathy among the professionals. So with all these things, I think the concerns raised are genuine, and I think there is definitely a need in our current approach to healthcare system.
Yeah, thank you. Thank you for inputs, Dr. Mrinalini. So your perspective, you feel the perspective, your side of view is, you feel it is body-related approach is the approach by the modern medicine, and you also feel that solution-centric approach is required, and you feel quality is more important and empathy is required. Okay, so let me go for the next panelist, Dr. Soumya. Can you give your inputs regarding, do you think there's a need for change from the current functioning of the healthcare system? Welcome,
Dr.
Dr.
Soumya has
Soumya.
not
Not there?
joined. Yeah,
Okay,
yeah,
okay,
she's not
okay.
here.
Thank you, thank you. Okay, let us move on to Dr. Aparajita Singh. I think she's there. What do you think, ma'am, about these
Yeah,
concerns? Yeah.
yeah. I was just listening to all the panelists and would see that would I also happen to see that there is a lot of how we can provide as I could hear that hospitals are like full. So hospitals are full. A lot of as if the population is increasing and how many hospitals are available. Definitely, we got to do something about it, and also how to make the healthcare affordable to everybody. As we see that the prices are rising, and that also we do see that a lot of developments that have happened in the field of healthcare, wherein some years back, even a knee replacement was something that people used to like think many times. So many of these facilities are available today everywhere. And yes, the mental health thing, there is a requirement of it. But yes, the systems are becoming better, and we have to really do something about how to expedite this. That is what I think. I look forward for what is to be offered, what is being discussed in this workshop, in this conference, to see what solutions are discussed. Yeah, thank you.
Yeah, thank you, Dr. Aparajita. So you feel that already we got so much developments, and affordability is crucial in deciding patient treatment. So let us move back to the The first panelist, Deepesh ji, and as Dr. Mrinalini told about, the solution-centric approach is required. Of course, the quality is important. What do you feel about that? Already you feel, no, it is adequate, everything is perfect. But what is your opinion regarding that, Sri Deepesh?
Okay. So I was listening to what Dr. Vadali was actually putting forth. So one thing Dr. Mrinalini was actually putting forth is about and I'm glad that she's appreciating these current development, what is happening in terms of technology, which is impacting or revolutionizing the medical treatment in a big way. But she was putting a concern that it is not accessible for the common man, more or less. So generally, if you see the kind of workaround, what we do is that we go for these medical insurances for people in many of the developing countries, if you look. So when the cost of the equipments is rising, of course, we cannot do away. For example, if somebody has come for with a stroke or something, then we need to go for that medical imaging or uh, the the for the diagnosis purpose, and it might need multiple images to be taken, and all those things. The scan report also might be needed. So we cannot do away with that, and that's part of the diagnostics. And what we have to do is that we have to find some workaround to provide the patient with the kind of financial support in some way. Of course, that has to be done. And then I think as and when the time passes, when the cost of the machines also might be drastically reduced, and it is becoming more common, just like the X-ray machines are so common right now. So similar to that, probably what I see is that at the initial stages, instruments might be costly, and then down the line, we have to do something to reduce the cost. And I totally agree with what Dr. Minal was pointing, that it has to be provided for the common man. Accessibility should be there. That definitely should be one of the highlights which we all should work. The research should go in that line. The development in the technology also should go in that line. I totally agree with that. But then again, that doesn't put a significant point that we should go for a big change in from what we are progressing right now in terms of technology to a different perspective. So that's what, and of course, I totally resonate with what Dr. Kumar was saying about the doctor being patient friendly. Of course, that has to be there. That and all I agree. But I'm thinking loud, like, do we need a change considering these points? That's what I'm thinking, Dr. Satyanarayan.
Yeah, thank you, Sri Dipesh. So you feel time will tell everything, time will lead to more and more solutions. As also you feel that, partially you want to get a change. Okay, let's move to the round two. Let us have some more questions. And so let us see. We have all been trying in various ways to overcome some of these concerns. Should we be trying to address these various concerns regarding the system separately, or could there be a common thread at the root of all these concerns that is addressing? Is that perspective our approach is right, or could a holistic approach to health perhaps address many of our concerns? Should we be looking at health in a more holistic manner? So let us start with Dr. Mirnalini. Should we be looking at health in a more holistic manner? What do you think, Dr. Mirnalini?
Yes, Dr. Satyanarayan. Like I was previously telling, we definitely need to look at healthcare system in a more holistic manner. The reason I say is this holistic approach has got many advantages. It prioritizes the root cause over the symptoms of any diseases. And when we prioritize the root cause, it says indirectly that the person takes responsibility for his own health of the body through self-awareness, self-care, and lifestyle adjustments. So this addresses the issues of uh, accessibility and affordability. And when it comes after getting disease, they need to run to hospitals, which was already pointed out are being overcrowded. And regarding this affordability, where the cost is high, even though insurance companies are there, not many are able to procure this insurance. And even with insurances, there are many limitations. So when an individual is approached holistically, where the self is given more importance, or the root cause, which I would say is one of the root cause is the mental issues, when that is also given priority, which is currently lacking in our current system, then they become more self-aware and they tend to follow more self-care routine and lifestyle routines. And this human being will be looked with the interconnectedness of this mental and physical well-being. And I would say right now, this increase in sedentary lifestyles and poor dietary habits, they contribute more to non-communicable diseases. And this can also, through self-awareness and this holistic approach, through proper dietary intakes and small inputs of exercises and labor in our day-to-day routine, not necessarily putting out some 1 hour or 2 hour daily to do exercise, rising up early in the morning. Even with our daily activities, we can incorporate some healthy lifestyle habits, healthy postures, breathing habits, which hardly require 1 or 2 minutes in between our busy schedules. For 1 hour, we can take 1 or 2 minutes to practice this, and again do our routine work, and again take 2 minutes to practice this. So this, like, if this is incorporated, this will, I feel, produce a huge impact on the entire way people live more through this. So yes, I think we should be looking at healthcare system more holistically than what is now being compartmentalized with the body, and even within the body with more specializations on individual parts of the body.
Okay, thank you, Dr. Mrinalini. You feel we should take responsibility over the body, and if you want to include the self also in your holistic, for the holistic approach. Okay, so what do you think is the missing thread, that common thread at the root of all these concerns, What do you feel the common thread?
I feel the common thread here basically is lack of self-awareness. People have become more materialized, more commercialized, running behind materialistic
Okay.
things, thinking that is the source of their happiness. So I think this is the root cause, the lack or awareness that there is something more beyond the body in the human being. Maybe when that comes into prime light, people will start putting that as their primary focus.
Okay. So thank you very much for your inputs. Let us move on to Sri Deepesh. Dr. Mirnali has highlighted, the missing link or common thread, which is there is awareness of the self or self-awareness. So what is your opinion on that? What is your view?
Right. So let me put my perspective on that.
Yeah.
Appreciating what Dr. Murali has put forward is very rightly. But then my thought about is that, so you have put in your health slide about the program of health, what I remember as the first part being the addressing of the intake and the routine and all those labor and exercise and all those things. So my thought is that should we take those things definitely as part of the medical education, or is it something which we have to incorporate in the general education as such, and so that the students are having this as part of the
Yeah,
general
sorry to
education?
interfere, Sri Deepesh ji. The implementation will be separated dealt on the third day. So can you focus upon this, should we be looking at health in a more holistic manner? So if
Yeah,
you
that's what I was
that,
exactly pointing, Dr.
yeah,
Satyanarayan.
yeah,
Actually, I was thinking like, I was reflecting to what Dr. Nalini was putting forward, that as such, the domain what we are speaking about as the modern medicine is self-sufficient, even though there may be reasons why people go for that, indulging and all those things might be the reason for getting the diseases for them. But then, as I see the medicine part, what we are having right now is having a boundary where we are self-sustained and is going in the right direction. That's what I'm trying to say. And the other part, what you are talking about as the holistic health, can be the part of the medical education thing in the background, but then it can be more in the general education. That's what I'm trying to put forward.
Okay, fine. That's nice. Thank you. Let us go back to Sri Swapan Chanana. So you were talking about time management, right? And as well as, the affordability as well as the technology in the hospital. So what is your viewpoint on, intake, daily routine, what was Dr. Minal was pointing out, that self-awareness, all these things. Can you share some views on that?
Yes, I'm working on myself also. Like a few years back, when I was not doing this UHV, this holistic approach, I found that my body was not keeping well in a way that I was fitter from the outside point of view, but then there was a headache, continuous headache was there. And then I found it because of the conflicts within. I was very unhappy within. But then I was pretending that I'm happy and carrying on my life with all that struggle and all that. But it was putting a lot of pressure on the body. So my point is this, that till we will not have holistic approach, and we will not have the holistic understanding, the reality. I think these are all these, we are going for the symptoms and then we are trying to fix them. Like I was, to reduce this headache, I was going to a lot of walks and a lot of physical exercise. For the time being, the stress was being reduced, but then the issues within, this trust issues, relationship issues, they were causing a lot of stress in the body. So I think to reduce that stress, we are doing some piecemeal solutions. Some people are taking over their overindulgence, like they are overeating, and then again, these heart diseases, BP is on, because I belong to an industrial town where there's a lot of industry and a lot of money, a lot of material. So I can see, I can observe in my surroundings that people are overindulgence because they're thinking themselves as body. So basically, they are unhappy. But my feeling is this, that now all this mental health stresses, and they're trying to overcome that by doing indulgence in one thing or the other thing. Like even they are doing into cigarette smoking and all, drinking. If you see in your surroundings, means all the, even the parties and all that, they are not complete with all this. My feeling is that people are really means unhappy within, and they're trying to get happiness from outside. And because they are trying to take this body as a source of happiness, so I think they are harming the body more. Rather means so holistic approach is needed. That who am I? Am I a body or I am something more? So that I can take responsibility of my body. So I think the more I have to work within, because if I will work within and see this, the reality, that who am I? Am I the body or I am more than that? Or there's a coexistence of I and the body. And then in the end, I will take the responsibility of the body. Then obviously, this all intake, daily routine will come automatically. So I can take my example that these three first, like intake, daily routine, and physical work. I'm working on this only, and then my headache has vanished by itself. And even my body has become leaner. I've reduced by 10 kg weight. That's my take on it. Thank you.
Yeah, thank you. Thank you, Dr. Swapan Chanana. With your valuable experience, you are quoting that, you want to have a holistic approach, and you want to find the root cause is, basically the missing linkage. We approach everything through piecemeal way, as isolated manner we approach things. Okay. So let us move back to Dr. Aparchita Singh. So what do you feel, ma'am? Your issue was, affordability. So if you approach things by a holistic manner, will affordability will change? Is it affordable for everyone? What do you feel?
Well, I'll have to just look into like what are the systems are today. If we see,
Yeah.
like we are just looking at how we can deal with situations when situations get bad. Like, so it's like you eat whatever you want to eat and then just digest it with some pill that is available. So are we just helping the person to eat right itself, or we are just focusing on how the person is going to digest whatever he has had? So like we are doing a lot of like lifestyle awareness drives, mindfulness drives for people so that they become mindful, go for vaccinations and all of that. But we'll have to just see that are we doing it enough? Like we may be doing like some percentage of what is our focus on, how much percentage of our focus is on this. It's like the when the there's all over, fire is all over. Now we are going doing this firefighting, you know. So when the disease is full
Yeah.
blown, how to deal with it? Maybe that is what we are doing. Though I can see that uh, people are having those lifestyle problems because of which diseases are there. Uh, are we focusing, like I can see that those sensual pleasures that people are going for, or it could be even a gym that a person is doing is just for uh, looking good, or is it health behind his mind? Moreover, all the protein that gym person is consuming, like at times feel that is all that consumed. We are getting consumed by these uh, being consumers there. Is it really healthy? So I just need. I also find when I see the this industry, there also a lot of specialization is there. We are taking heart as one portion, like just different from the brain, as if so we'll have to see, are we really dealing with things in a holistic way, even in the at the level of the body also? So I don't know, like what is the range of which what we are talking about. So like if it is the heart, we are specializing in that heart only. What about is as if it is not connected with the rest of the body? I don't know. I have certain this thing. So when we say holistic, like what exactly are we wanting to mean by that? And how are we going to deal with these issues? So many issues are there. A lot of problems, like mental health problems, are there. Mind and body is different. Mental health itself is a problem today. So holistic, even mind and body, holistic. How are we going to deal it? Like, what is the basis of it? I just want to know what are we going to discuss out here in the conference. I am looking
Yeah.
forward for it.
Yeah. Thank you so much for your contribution. And of course, the next, tomorrow we will have a vision on holistic human health. I think in that you will get the answer. I'm glad that you are open to, possibilities of change. And so we will come to the next part of our panel discussion. And we go for the questions from the audience, if any, the participants. Let us move on to the questions. I think let me check it. So I think audience, you can unmute your mic and you can ask questions, or you can raise your hand if possible. Any questions? So related with concerns, current perspective on holistic human health, or about the holistic need for change in current um, um, uh, perspective. Anything you can ask? Our panelists are ready. So any questions are there? So if there are no question and answers, and
There is
we'll
a
move
hand
on to
There
raise.
is a
yeah,
There
question,
is a
I
hand.
think.
question is there.
There.
Yeah, let me see. Yeah. It's put in the chat box or?
Hand raise is there, yeah.
Oh, sorry. I'm sorry. I didn't notice that. Yeah. It is, Mrs. Vasanti. Can you, Vasanti Vasareddy, ma'am? So can you put your question? Mrs. Vasanti Vasareddy, ma'am, are you there?
Namaste, sir. Am I audible?
Yes, you are audible. Yeah.
So I think everyone is. It's nice that everyone is focusing on holistic health issues and all.
Yeah.
But my doubt is, like a layman, I'm asking, like Deepesh
Yeah.
ji was pointing out, like whether this must be in general education or that caught my point. But now my view is that doctors, I think they are also doing it holistically only. because when
Okay.
any patient approach them, they cannot
Okay.
take a class from the beginning like physical labor, all these things. They first of all they have to attend to the disease. That's what they are doing. I wonder where they are missing. I don't think that they are missing it out.
Can you briefly put the question in a single line? Is it possible?
My point is that
Yeah.
doctors are also doing the best.
Okay.
So holistic approach is not something separate from the treatment.
Okay, it is already existing. Yeah, okay. Whom
Because
you
when
want to put the question? Any panelists, no,
I thought of acknowledging Deepesh ji's opinion.
okay.
It's
Okay.
like because awareness is different and treatment is different. Doctors cannot take care of all these things because they have to attend to the patient and they treat. Otherwise, time waste for them. So general
Okay.
education, a casually that has to be in line with like in from school itself. I have to because in
Okay,
my school.
fine.
Thank you.
Dr. Mirnalini is there? You want to answer the question? Mrs. Vasanthi Vasireddy's question that, she asked why, already it is doctors are doing that holistic
Yes,
approach.
Dr.
Yeah.
Yes, I
Yeah.
got the question.
Yeah.
See, like we had seen the keynote. When patients come to doctors, they come when they're not able to take care, when their body has gone into such a disharmony that they need medicines and some treatment to bring back that harmony in the body. So, as you rightly said, at that stage, patients need to be addressed through this modern medicine, through medicines and treatment and whatnot interventions. But I feel, see, like I've been seeing in my practice, once you start giving medicine to the patients, it doesn't stop there. Maybe temporarily it gets relief from the disease or from the symptom, whatever they have. And again, after a month, they come back. And again, after a month, they come back. So this keeps on going like a cycle. And I am seeing practically that the disease is also progressively getting worsened. So what we start as one medicine at a time for the first visit. When they come to the third or the fourth visit, we start prescribing, in addition to that first thing, another medication. The patient starts taking two. So it is not that treating the symptoms curing the disease. This is what we practically see. Maybe for some communicable diseases like common cold or fever or other pneumonia or something like that, yes, one time treatment, it cures the disease. But for non communicable diseases, like most of the diseases like hypertension, diabetes, in modern medicine, we simply term it as essential hypertension or primary hypertension, which basically means there is no cause. The medicine couldn't find a reason for why the patient is getting that. So they simply give drugs to lower that symptom. And like I said before, it doesn't stop with one. So as the years pass by, the patients are getting more and more aggressiveness of the disease, and more tablets are being added to the existing one. So that is why I feel, when we maybe look into that root cause, there is something apart from that body or which is influencing the body, to get the disharmony, something which is having disharmony. Maybe in tomorrow's conference, we'll get to know more about this. So maybe when we start addressing the root cause, addressing the human being as a holistically with this mental health and our bodily issues, then I think in addition to treating the disease, we can also address the root cause. So the disease severity also does not get progressed. And maybe in due course of time, there might be a cure, which is currently not happening in our current healthcare system. So that is what I was trying to say. Like we need to look at the patient and the healthcare system more holistically. But right
Okay.
now, I agree with you.
Yeah.
The current medical system is doing a good job at managing diseases, but
Okay.
we need a holistic approach.
Okay. Thank you for the prompt answer. And we'll move on to, I think that answers your question, Mrs. Vasanthi Vasireddy, I think. So let's move to the next question. Why
you.
people are, why people are getting anxiety, depression issues more these days? Any panelists want to answer this question? Why people are getting anxiety, depression issues more these days? I think Dr. Mirnali can again think. Yeah, thank you.
Like I already told, we are all okay, including me at some point. We are all running a rat race. Okay, we focus more on accumulating more physical facilities, more materialistic things, thinking that If we accumulate more, that is going to safeguard our future, and that is going to give a contented life and a happy life. So, but when we see there is lots and lots of competition, because every individual is thinking they need to accumulate more and more. So there is increased consumption rather than equality in production and consumption. There is more consumption among the people, and people fear. They live in a fear-based living, fearing for a loss of resources, or fearing that they don't have competency to acquire these resources. So I would say that the root of all these things, increase in anxiety, increase in depression, and all these things, is where we put our focus on. So if we focus on being happy and try to find out the true source of happiness, then I think this issues of anxiety and depression will automatically come down. With our current state where everything is a competitive world, a commercialized world, where everybody is running behind our physical facilities. So I think, yeah, I can see the question. Students are also getting anxiety issues.
Yes.
Obviously, there is so much of peer pressure among them. So they have all entered into highly professional field technical education. So there is a competition there also. So yes, and there is also a lack of clarity in relationships. So yes, there is going to be an increase in anxiety and depression.
Yes. I think tomorrow we'll get the answer for all these questions, I hope, because no vision is on tomorrow. So I think so. And let us want of time, we'll move on to one more question, last question. Are patients becoming consumers of the pharma industry? Are doctors and values to be questioned?
I don't want to really interrupt, but we have only 5 more minutes.
Yes, ma'am. Yeah.
Sorry
So
to-
we can move on to conclusion remarks, concluding remarks. Okay. So thank you, everyone. And finally, we'll come to the conclusions drawn from our panel discussion today. And we started with Sri Deepesh ji, and thing is, he felt more or less it is technology, pills and all, it is sufficient as of now. But later on, he went he became more open, and he want to have a change partially. And Swapan Chanana, Dr. Swapan Chanana, he felt the technology in the hospitals are more, but to focus upon the lifestyle modifications, as well as his own experience he shared, his change in headache because of the response self-regulation and all he explained. And third panelist, Dr. Mirnalini, of course, she shared her perspective on the thing that is on we treat only the symptoms and we consider human being as only the body, and we have to go for solution-centric approach, and quality is more important than quantity, and the empathy is lacking in the current medical practice. So the last panelist, Dr. Aparajita Singh, she felt it is affordability is a critical issue, and she also felt mental health issues are more, and we to focus on more on the lifestyle modifications, mindfulness, vaccination, and all. So I think to conclude, most of the panelists they want us to have a change, and that can be brought in a systematic way with having a vision. So tomorrow we'll meet there for tomorrow's panel discussion. So let us conclude the session. I hope it was fruitful exploration on the need for holistic human health. So tomorrow we'll be meeting at the same time for the panel discussion on the vision for a value-based holistic perspective on health. Thank you very much, participants, as well as the panelists. Namaste.
Very nice. Few things that I thought I could notice. I'll just briefly, time I know is up, but I'll just briefly put a few things that I felt we can work on. I think when we are putting our views, when the question is put, if we can crisply put it, sometimes both sides we are talking. Like for instance, Aprajita ji, I could tell, or in some of the people are talking from both sides. So in that case, how do you conclude what they have actually said? So maybe the moderator has to then crisply ask them. So are you saying that there is a need for a change? Do you think that something we should change, or do you think things are fine? So that you get a concrete answer from there. When it comes to a holistic approach, many people shared that maybe we do need to do something. I think the need part was more or less, most people said yes to the need part, except maybe Dipesh. But so that also we can put forward that, uh, we don't have to summarize everything they say, because they're saying a lot of things here and there that it will waste a lot of time. So you can just, the moderator can just crisply put it, when it comes to the need, I think many of us felt that the need is there, but whether a holistic approach or what we really need to do, I think we'll have to, wait and see. Tomorrow, perhaps, when we talk of the vision, then we can see, what the conference has to offer, and then proceed with the discussion or something like that, which will be a little like, we are not saying that yes, everybody wants a holistic approach kind of thing. So a little bit there, no, I was thinking. Also, we were talking about the program of health. That's on the second day. So as far as I know, that's on the second day.
Yes,
So
okay.
here we can talk about what is generally known to everybody. We can talk of mind-body connection. So we could say that, we're talking of body health, but I think there is a lot of awareness today about the mind-body connection. And so, in health, do we really talk about the mind-body connection a whole lot? Something like that, so that it sets the tone for the next day. But to bring up the program of health, if we do here, we'll have to talk about Ayurveda, because we have not opened it yet in our conference. So that we should keep in mind. We can open it, there's no doubt, but then we would have to say, like in our traditional systems, there is talk of this. We don't talk of all this in our health, and that's fine. We can mention that. The timer, we'll have to do something about keeping the timer, not just for the panelists, but also because we have to time that it has to go, smoothly till the end, till the conclusions. So perhaps we'll talk about that, maybe not today, but if we go back to the slide which talks about the times, how much time for each thing, then the timer can be put for that. In the slides, it is there, I think.
Yes.
Before this day one, I think it might be there. Or it is after day one, I don't know. No, maybe it's after day one.
After that,
After day one.
No, not there. Here I think. This slide.
Something here, no? So
sorry.
I changed some of the timings because
That's gone.
we need enough time for the, what happened?
Something skipped.
So anyway, we can look at that.
Yes.
And the timekeepers can, check the time here and then accordingly put the stopwatch, so that we are not missing out on things.
Or we can put a continuous display of the time throughout 1.5 hours. So we can know, moderator can guess, where are they, which part of the
Oh, that
session.
will be difficult, because the person who is speaking in the panelist, then the moderator will have to keep track once 3 minutes are up, and then.
Yeah, that is separate. 3 minutes will be separate. This is
Okay,
separate.
okay.
Like
that you're saying. So 2 timers.
Yeah, 2 timers. Yeah.
Okay, we'll have to see that then. Timekeepers, just explore that and
sir.
see what we can do about that. I think the conclusions need to come a little more crisp.
Crisp, yeah.
So that it's clear what exactly we are saying. And I think now we'll stop here, because when it comes to, this part about change, I think many people said that, yes, perhaps change might be good, but we don't know how and all that, many people said. So I think there you can just give a broad this thing that many of us as panelists felt that there is some need for changing things, but how we are going to go about doing it, that is a little uncertain. And so maybe we need to wait, like you said, for day 2 and see
Yeah.
how things will go. So nice, very nice. I think we can stop here
Yes,
and
yes.
meet after dinner.
Huh.
Thank
Thank
you,
you so
everyone.
much. Yeah.
We'll meet for the day 2 discussion at
Yeah.
8:30.
Didi, actually, I was out a little bit sometime. I didn't listen. Was there anything very important which I have to take it to the next session? Was there anything like that?
No, I think that's fine. Um, uh, whatever you want to say, if you can just say it a little more crisply, that'll be good. But you pretty much put your point that, things are fine the way they are, and that's okay. That's fine. I mean, everybody has a right to say whatever they wish to say as a panelist, and that's fine. I don't think anything really. But whatever we want to say, if we are saying, half this way, half that way, then it's difficult to make out. Like, I think Aprajita ji, your input could have been a little more crisp, because when we talk of, healthcare system is like that, remember we are talking as doctors. So we will feel strongly about one thing or the other. And so we can put it there more crisply. Actually, in the actual time, we won't be doing this, so it won't be an issue. But just for our rehearsals, it's something that we can bring forward so that we think about these questions. I was noting down some of these questions, and we can see for responses to these. Nice, very nice. Thank you, everyone.
Okay, thank you. Namaste. So now at what time, Didi? 8:30?
8:30, we are supposed to meet. So
Okay.
it's already 8:06. I think we'll stop here. Let's all
Yes.
break for dinner and then come back at 8:30. From 8:30 to 9:30, we're going to talk about day 2 and then we close for the night.
Yes, Ji. Thank you.
Thank you all.
Namaste, everybody.
Namaste. We'll meet soon. Aditya ji is there?
Ji Didi, I am here.
May I?
So what do we have to do? We have to leave, end the meeting.
Okay, Didi, I am claiming the host. And okay, namaste to all. Thank you for the session.
And we have to meet at 8:30. So should we reconnect then? Restart?
Okay, Didi.
Or should
8:30.
we have one more session from 8:30 to 9:30. So should we
Didi.
end here and start again?
Just let me check if it is a different one or the same one.
Yeah, so we will be leaving this session and we will be connecting the another session planned for this particular health session from the 8:30 onwards. So we will be connecting into
Okay,
that session.
okay, okay.
Yeah.
So we need to end this then?
Yes, so we need to
Okay.
end this and we'll
Yeah.
reconnect into that session which is already assigned and designed.
Yes. Got
Okay,
it.
okay.
Team will be available 5 to 10 minutes before to start this session and everyone can join furtherward afterwards.